Hi, I am Dr. Sampurna Ghosh. I am ENT consultant of Sunshine Hospital, Gachibowli, Hyderabad. Today's topic is common cough and cold. So, this is something which is the most common cause of being absent from the school in the childhood and also being absent from the office for the adults. So, what are the reasons for common cough and cold, how to get rid of it, and if there is somebody who keeps on suffering from common cough and cold 4 to 5 times in a year, there are many people like that actually, then I will also discuss that what is the reason why it is for you it is coming back again and again, and how to reduce the frequency and severity of the problem. So, the most cold and cough comes from viral infection, and it goes away by 5-7 days. So, you may not need to take antibiotic, it can be managed with some simple remedies. If you have fever, you can take paracetamol, you can just take anti-allergic medicine, you can use steam inhalation, or if you have a sore throat, you can do simply hot water, warm water gargle, mixing some salt with it. So, these are the simple remedies during cold, and you should drink lots of water and take some rest, and usually you can come out of that. Many a times nowadays people are buying medicines from the pharmacy on their own and just taking antibiotic whenever they feel like, and then they don't complete the course also. This is really bad. By doing that, what we do, we reduce the resistance of our body and we make the bacteria or the microorganism resistant to many drugs. So, when actually it is required, when you have a bad bacterial infection, then the same antibiotic may not be act for you, it may have become resistant. So, my simple advice for you is, if you have simple cough and cold, try the home remedies for couple of days. If it is not helping, meet the doctor and let them decide whether you need antibiotic or not. If needed, what antibiotic and what dose. Please do not do self medication. Coming to the topic, that what are the reasons for recurrent cough and cold in children. So, one thing is very common if you ask the parents, that whenever the child starts going to play school, or the children who lives in a creche, or when the child goes to a nursery school, immediately they catch some cold. This is very normal, because there the child is mixing up with many other children. Otherwise, till date the child was only confined with in the home environment. So, as they start growing out, they get different kind of virus or bacteria from the society, and getting this, they also develop their immunity. So, there is nothing to be afraid about, or no need to restrain them from going. Initial years they will develop cold and other infection, and they will develop the antibodies as well, so that in adult life they have enough immunity to fight against different kind of infection. But suppose a child is having too many episodes, and each episode is coming with high fever and not able to breathe, and some symptoms are always persisting. The child is a mouth breather, or the child is snoring heavily whenever they get cold. Also, if the child is having high fever along with ear pain, these are the symptoms you must meet the pediatrician as well as the ENT doctors. One of the very common reason for this kind of recurrent cough and cold, which is just not subsiding and its nagging problem, is a very big tonsil and adenoid. And nowadays this problem is increasing rampantly, maybe because of the environmental factors or fast food or the pollution in the air. Whatever the reason, many kids are nowadays highly allergic, and these children are prone to develop a very big tonsil and adenoid. They need attention. So, if your child is a mouth breather, if the child snores loudly, if the child can't sleep comfortably at night, if your child is having high fever, cough, cold, throat pain, ear pain 3 to 4 times in a year, then this is not normal. You have to take to the doctor to discuss what is the reason, and according to the cause detected, either medicine or investigations or surgery, whatever it is, the child should be treated. In adults, another reason for recurrent cough and cold is allergy. So, many people may have dust allergy, food allergy, or people who have pet at house. Some people do not tolerate that. So, if you have that kind of tendency that you have lot of running nose and sneezing, and early morning you always keep on sneezing. So, there are some home remedies that you have to avoid dust. You do servicing of your AC machine and coolers, and keep the curtains and the carpets always clean. that can reduce the tendency to develop recurrent cough and cold, and of course ENT checkup is required if you have a deviated nasal septum or some kind of sinus issue. That may be a reason for you to have recurrent cough and cold. If during cough and cold you have some kind of breathlessness, then also keep in mind that there may be mild asthma both for children and for adult. This thing should be ruled out by a general physician, by ENT specialist, that is there anything wrong in the nose or in the throat or in the lungs which is developing, which is giving rise to recurrent cough and cold. So, basically it is a airway disease, airway starts from the nose to lungs. So, this checkup is required if it is coming back to you again and again.